Hello everybody, my name is Dr. Moses Tabe-Ambilichu. I'm a board certified psychiatrist here in the United States of America. I'm the Chief Medical Officer at Success Health System Worldwide Psychiatry Services, headquartered in Columbia, Missouri, and also practitioner at Advent Health Shawnee Mission. Today I have the pleasant opportunity to talk to you about another mental disorder which is very important, called bipolar disorder. There are two kinds of bipolar disorder. There's bipolar type 1 and bipolar type 2. For the purposes of this video, we'll talk about bipolar type 1. What are the salient clinical features of bipolar disorder type 1? Patients present with feelings of grandiosity, so they may feel on top of the world. They may feel they have special powers. Their mood is usually euphoric. They feel extremely elated, extremely happy. They would have rapid speech, pressured speech. They have the need to keep talking. They would have what we call flight of ideas. When they're talking, the thought process, they go from topic to topic. Patients have high energy levels, right? Even if they have very little sleep, they feel elevated energy. They have, of course, I just mentioned, reduced need for sleep. 2-3 hours of sleep is all people may need, and they still have a lot of energy. Some patients may develop what we call delusions or psychosis or hallucinations, things of that nature. They might feel they have special powers to resolve a difficult problem, for example, the Middle East crisis, for example. A lot of these patients require hospitalization, given the magnitude of the disease process and the degree of disability and impairment. So we end up treating these patients in the hospital. Typically, symptoms last about a week or more, and without treatment, there's very little chance that the disease can just get into remission on its own. So when the patient comes in front of us in the clinical setting, we will do a clinical interview. We will talk to family members as well, obtain collateral information to arrive at a very reasonable diagnostic assessment. Lab tests are important. We'll draw for labs to make sure there are no electrolyte abnormalities in the patient's blood, or make sure vital signs are stable. We particularly check for thyroid-related problems because hyperthyroidism could mimic bipolar disorder. Concomitant drug use is important. Drugs like cocaine, amphetamine, other kinds of stimulants, or even non-stimulants could mimic symptoms of bipolar disorder. Once our diagnostic assessment is complete and we are fairly certain, we will proceed to establish treatment. We'll talk about the treatment in detail in another video, but just to summarize, the treatment for bipolar disorder type 1 typically begins with the prescription of a mood stabilizer, which is an anticonvulsant usually, and an antipsychotic. The combination seems to work well in the beginning phase of treatment. In later stages of treatment, the antipsychotic may be removed. Additional things we may want to do, want to make sure that patients are sleeping well. Insomnia is typically a problem that could contribute to fuel a bipolar manic crisis. So we want to make sure patients are sleeping at least 7 to 8 hours. Other lifestyle things are important: removal of substances, removal of alcohol, prayer, meditation, exercise, yoga. All of these things are important. In the next video, we will talk a little bit more in detail about the kinds of medications in the psychopharmacology, and probably one of our colleagues will join us for that session. For now, please share, subscribe to our channel, educate other people. Let's together fight the stigma against mental illness. It's very important that people around the world understand every area of mental illness. That way, an educated patient is always a better patient, and we could fight the stigma together. Thank you for listening to the next video.